There's been a massive government initiative in terms of the increasing the mental health care plan rebatable sessions from 10 up to 20 per calendar year since COVID. So that's been quite significant. So if someone has, when we go back to that adaptation reflex, the idea being that sometimes a distressing event can occur, it takes us time to recalibrate. We use all our cognitive strategies, social strategies to bring ourselves back to baseline, to where we were before, yet sometimes it's a bit too challenging, and that's when it's good to go and get some extra input, coaching, friends, family, support, counselling. So let's say that's one of those times, and I think that's really important when the demands are greater than our personal resources. Let's go and do that. So that's why, I think the mental health care plans now make it so much more accessible for people to be able to go get a referral from a GP and get up to like half the session for free from the government. So that's great. Now, what I think the government could potentially also explore, and I'm very keen to expand the conversation on mental health because my specialisation is more inner well-being and happiness, not just the what I would say is the introductory level is mental health. I often liken it to a bit more like the emergency department. Someone comes in because they've got a genuine crisis and they need help. So they get the help and then we solve it. And then typically they, if the practitioner is good at what they're doing, they can help them sort it and then they go back out. But they often haven't had time or haven't looked at how to change the strategies and the patterns so that in 2 years to whenever time, then a new crisis occurs. And so typically the mental health care plans, the way the government has set it up, is that you're eligible for those rebates if you hit certain criteria. If you're struggling with anxiety or depression or PTSD and so on. And that is kind of, you then are able to access, get financial support. But it's interesting, they've if I swap to something like sales, and it's complete, sounds a non sequitur, but they've said that it takes 6 times more cost to create a new client than it does to retain an old one. And so, in other words, if we can assist people not just to get out of crisis, but there's also funding to assist people to maintain well-being, then they're more likely to continue down that track versus be given a short, sharp intervention that deals with the issue, but not enough time to be able to change those processes and those patterns and build a foundational lifestyle of well-being. So I'm very big on exploring that. So I think the shift should be, not just from mental health, which I think is really compassionate and critical resilience work. I think it should now, the conversation should be expanded to maintaining well-being and to shift the paradigm. I'm big on shifting the paradigm from event-based well-being to inner well-being, because once you're in that place, and it's much more of an untouchable place, if things affect you less, then you're going to break down less, and therefore there's less need to access services that then cost the government, etc. They found, for example, in the research, someone that struggles, say, with anxiety is much more likely to be accessing a range of medical services not connected to the anxiety than someone that's not, simply because we worry more about a lot more stuff. So I actually think it's cost effective for us to explore the well-being model as well, not just the introductory compassionate mental health model. I think we need to expand this to well-being. So it's at the prevention level, but then it's also, if someone has had issues, that there is more, in a sense, training of psychologists and funding to support them to be able to walk with someone on building a solid well-being. Walk with them along that journey so that they can actually build that more robust inner state, which then is less affected by everything. So I think that's the conversation that needs to happen now.